Assalamu alaikum. I am Isma Sayyed from 5th Prof Morning. My roll number is BP 1650097 and I am here covering a topic named Cilastatin. So what is Cilastatin? Cilastatin is a drug. It is actually an inhibitor of an enzyme renal dehydropeptidase. This enzyme is responsible for the metabolism of phenamycin beta-lactam antibiotics, and it is also responsible for the conversion of leukotriene D4 to leukotriene E4. So it actually inhibits the enzyme renal dehydropeptidase. The mechanism of action of cilastatin. Cilastatin works as the same as that of the other beta-lactam antibiotics. So cilastatin is actually an beta-lactam antibiotic, and it belongs to the carbapenems class, and it has a broad spectrum of activity. As it works same as that of the other beta-lactam antibiotics, that by it inactivates the penicillin binding proteins and then causes cell wall lysis or cell wall breakage, and then inhibiting the formation of cell wall and its synthesis. The drug interactions. Cilastatin may interact with various products or various laboratory tests and can give false results or adverse effects. So some of the products are written here, which are ganciclovir, valproic acid, and some of its related drugs like divalproic sodium and sodium valproate. Cilastatin can interact with them, and the laboratory test with which cilastatin indicate is here urine glucose test. And when cilastatin interacts with them, the outcomes of the result may be false. Indications of cilastatin. Cilastatin is indicated every time in the combination with imipenem, and sometimes with or without relebectam. Relebectam is not always necessary to administer with cilastatin, but imipenem is necessary to always administer with cilastatin. These drugs are used in combination. Cilastatin is used to treat various types of bacterial infections. Cilastatin is also indicated in a condition called small cell carcinoma. Small cell carcinoma is a highly malignant type of cancer, and it mostly occurs in lungs and other of the body parts. Now here comes the contraindications, that in which conditions the drug should not be administered. Cilastatin is contraindicated in a condition called diarrhea, diarrhea which is caused by the bacteria Clostridium difficile, a low seizure threshold, other type of seizures, and the chronic kidney disease stages 2, 3A, 3B, 4, and 5. In all these conditions, cilastatin is contraindicated. Now, every drug has some side effects. So here are the side effects of cilastatin. Cilastatin causes swelling of many of the body parts. It causes redness. It causes pain in the body. Soreness can also be caused by cilastatin. Other side effects are nausea, vomiting, and diarrhea. Upset stomach and seizures can also be caused by cilastatin. Rational use of cilastatin. This medication is used to treat bacterial infections. As I told you earlier, that cilastatin is used to treat various bacterial infections. So some conditions are there. First one is endocarditis. Endocarditis is the problem of the inner lining of the endocardium. It is infection of inner lining of endocardium caused by a bacteria. Other respiratory tract infections, urinary tract infections, and the infections in the bone, blood, and skin. So this medication cilastatin is used to treat all these type of infections. Now the doses, how much dose we administered to the patients. So two categories are divided in adults and in pediatrics. In adults, two type of infections are written: intra-abdominal infections and urinary tract infections. In intra-abdominal infections, mild to moderate dose is 250 to 500 mg, interval of 6 hours, and in severe case 500 mg intravenously dose at the interval of 6 hours, or 1 gram at the intervals of 8 hours for 4 to 7 days. In urinary tract infections, two conditions: uncomplicated and complicated. In complicated case, 250 milligram dose administered intravenously at the rate of interval of 6 hours, and complicated 500 mg dose at the same time of interval of 6 hours. Now in pediatrics are in less than 1 week, 1 to 4 weeks. and 4 weeks to 3 months. So all these and greater than 3 months. So all these pediatrics whose weight are greater than 1.5 kgs should be administered with 25 mg per kg dose intravenously. Just there is a changing of time interval. In less than 1 week, the time interval is 12 hours. In 1 to 4 weeks pediatrics, time interval is 8 hours. In 4 weeks to 3 months pediatrics, the time interval is 6 hours, and in greater than 3 months pediatrics, the time interval is 6 hours. And it is all for the non-CNS infectious conditions. The children who are greater than 12 years must be administered with a dose 10 to 15 mg per kilogram intravenously at the time interval of 6 hours, and it is for mild to moderate type of infections. Route of administration of cilastatin is intramuscular and intravenous. Alternative drug. The alternative drug which can be used instead of cilastatin is metronidazole plus a third generation cephalosporin, ciprofloxacin, and aztreonam. Here are some brands of cilastatin. So brands are divided according to the cost, according to their costs. First one is highly costed, second one is moderately costed, and third one is low cost. So first is Hope, manufactured by Scientific Healthcare in the injection form in the packing of 1 gram. Its price is rupees 2,590. Second one is Imicella, which is moderately costed, is manufactured in India, Abbott India, in injection form in the packing of 500 milligram. Its cost is rupees 1,480. Then last one is Prepenem, manufactured by Hyanur Pharmaceuticals Limited in injection form in the packing of 500 milligram, and its price is 750, which is the lowest cost. Now the soap notes. Soap notes is actually what? Soap notes are the method of documentation of any patient's case study. There are four components of soap notes. First, S for subjectives, O stands for objective, A for assessment, and P for plan. So in subjective, we'll write the chief complaint medical history of the patient, its gender and age. In objective, we'll write the patient's laboratory tests, and its current status. In assessment, we'll diagnose or assess that from which disease patient is suffering, and in plan, we'll give the treatment to the patient in a medication form or in the lifestyle changes or any pharmacotherapy to the patient. Now here is our case study. Okay, so our case study is here's an 84-year-old chronic kidney diseased male. The male is always a male patient. The patient is always suffering from chronic kidney disease, and he attended the outpatient department at Afan Hospital in Karachi. Outpatient means he is not admitted in the hospital over the night. He is just attended the outpatient session, means come for therapy and then go away. And the patient has the chief complaints of lower abdominal pain, and he has pain and burning sensation at the time of urination and fever. Patient has a history of dialysis. He had received a dialysis, and he is currently taking the medicines of the blood pressure and cholesterol lowering medications in routine. This is the physical examination. After that, laboratory tests were done, in which urine microscopic examination done, in which bacteria found with large number of pus cells. Some laboratory tests are done in which C-reactive protein, which is 15 mg per dl, blood creatine level, which is 2.7 mg per dl, and total leukocyte count, which is 17,000 cells per millimeter cube with neutrophilia 80% were found, and the patient's BP is 110 beats per minute. Now we have to solve the case. Number one, there is subjective. So in gender is male. The patient is male. His age is 84 years old. The patient has the major chief complaints of suffering that he is suffering from the pain in the lower abdomen, and he has burning sensation and pain at the time of the urination, and he has a high temperature. Medical history is that the patient has undergone outpatient dialysis. He had received a dialysis earlier. Medications, the patient is taking cholesterol and BP lowering medications. Now the objectives. In objectives, there are laboratory tests in which C reactive protein test, which is 15 mg per dl. It is increased. Its level is increased. Blood creatine test, which is 2.7 mg per dl, and its level is also raised. Total leukocyte count, which is 17,000 cells per millimeter cube. Urine microscopic examination, in which bacteria found with greater number of pus cells. Heart rate is 110 beats per minute. Now here's assessment. All the laboratory tests have been done, and according to all these, now we have to assess that what disease from what disease patient has been suffering. So all the laboratory tests have been done, and we can see that the patient's C-reactive protein level is higher, which causes the inflammation in the patient's body. His blood creatinine level is also than the normal is also higher than the normal range. The patient also has raised number of leukocyte count. The total leukocyte count normal range is 10 to 11,000 millimeter per cells per millimeter cube, but the patient's is 17,000 cells per millimeter cube, which is increased level. Patient has the increased heartbeat of 110 beats per minute, and the normal heartbeat is 60 to 100 beats per minute. So these are all the laboratory tests, and now moving towards the patient's major complaint, which is lower abdominal pain and dysuria. Dysuria is difficulty in urination. So by all these signs, we indicate that the patient is suffering from severe kidney disease, severe kidney infection. And a test done of urine microscopic test, in which large number of bacteria are found with the greater amount of pus cells. It is the reason why patient is feeling pain and burning sensation at the time of urination. This test indicates that patient has painful sensation due to this problem. The organism which is responsible for causing all this is Chromobacterium violacum. According to all these information and all these signs and symptoms, we have diagnosed that the patient is suffering from urinary tract infection. Now to check that from which drug this organism is susceptible. So we have done the antimicrobial activity susceptibility test. Now the plan we have the now the plan that how to treat the patient. So we have found that this organism is susceptible from Cilastatin imipenem, which is always used in combination. Cilastatin and imipenem, it is used to treat various types of bacterial infections, as I told earlier. Cilastatin is a renal dehydropeptidase inhibitor, so it works by preventing the renal degradation of imipenem, and increases the concentration of imipenem in the urine, and minimizing nephrotoxicity. Nephrotoxicity is a problem of kidney. So it prevents, Cilastatin and imipenem can prevent the nephrotoxicity. The effective dose for our patient of Cilastatin is 500 milligram intravenously at the time interval of 6 hours, because the case of our patient is complicated. Other than the medications, the patient should have to change some his lifestyle. So the patient has to take plenty of fluids, and he has to take probiotics. Has to gain vitamin C from his diet and tablets, and this all can help to strengthen the immune system of our patient. When the immune system is strong, the patient can easily handle with all these signs and symptoms, and by taking the prescribed drug, the patient's conditions may go towards the betterment. And now our case is completed. Case has been solved. References from where I've taken all these is Independent M. Sharma and S. Khativada, asymptomatic bacteria caused by Chromobacterium violacum in an immunocomponent alert. Case reports, www.pubmed.com, www.druginfosys.com, Lippincott Illustrated Reviews, Pharmacology 6th edition, and Pharmapedia Pakistan. Here my presentation has been completed. Thank you so much.